Hello, my name is Nicoletta Colombo. I'm a gynecological oncologist from Milan, Italy. And I was very pleased to present in the plenary session 1 the results of our study, ENGOT OV 65 Keynote B96, which is a prospective randomized study looking at the addition of pembrolizumab to weekly paclitaxel with or without bevacizumab in patients with platinum-resistant or recurrent ovarian cancer. This study was designed with a primary endpoint, which was progression-free survival in the population with tumor expressing PD-L1 according to the combined positive score 1 and higher, but also in the intention to treat population. At interim analysis 1, we met the primary endpoint in the CPS1 and higher population, and also in the intention to treat population, demonstrated a statistically significant improvement in progression-free survival in both populations. The median PFS was actually 8.3 months in the pembro arm and was 7.2 months in the control arm, and this was for the CPS1 and higher population, and in the intention to treat population, we had 2 months improvement in median progression-free survival. But I think the most important result of this study was the overall survival data. And at interim analysis 2, with 27 months median follow-up, we were able to demonstrate a statistically significant improvement in overall survival in the CPS1 and higher population. But also there was a press release announcing that the overall survival benefit was also observed in the intention to treat population. The median OS was 18 months in the pembro arm, and this is actually the longest overall survival ever reported in this setting. And in the control arm was 14 months. And also I want to highlight that this was a very high performing control arm. Besides that, the toxicity profile was manageable. So we did not observe any unexpected adverse events in this population. And for that reason, we conclude that this is the first study demonstrated an improvement in overall survival with an immune checkpoint inhibitor in ovarian cancer. And the overall survival observed was the longest reported in this setting. And so we may conclude that these represent a new standard of care for patients with platinum-resistant recurrent ovarian cancer.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.